Hi everybody, welcome back. Today we're going to be doing dissection of the sheep heart. So you're going to want to go into your dissection kit and get out some things. First of all, you're going to get out your dissection tray, this blue tray. It's got a white mat inside of it. You're going to want to get out your bag of gloves, your little pouch of tools, and of course your sheep heart, which is preserved. You might want to put down newspaper underneath your dissection tray in case anything splashes. It's very easy to clean up. You can just throw out the newspaper afterwards. I did not bother with that today. So once you get your gloves out, put one pair of them on. You're going to want to save the rest so that you can come back to your sheep heart or for later dissections. You're going to want to get out a couple of tools from your tool pouch. I like to take out the big scissors. I'm going to need the forceps, the probe, this part, which is the scalpel handle, and you're going to need one of the scalpel blades. So let me show you how to assemble the scalpel. Remember, this is very, very sharp. It is designed to cut through skin, so you want to be really careful with it. You're going to open it up at the end where it says peel. You're going to peel those two sides apart. Oh, shoot. All right, well, mine fell out, but when you pick it up, don't use your fingers to pick it up. Use the forceps to pick it up. All right. All right. And you definitely want to use your forceps for this part because, all right, don't do what I'm doing. You're going to want to pick it up with the forceps because you don't want to put your fingers on this sharp part of the blade. Again, it's really, really sharp. So when you look at the handle, you can see that one side of it is kind of bumped up. It's got a little lip on it. The other side is flat. So you're going to want to hold the part that's bumped up. And at the end, you can kind of see there's a little bit of a groove. So what we're going to do is you're going to hold the blade with the forceps and hold it pretty close to the nose part because you're going to need a lot of force. And this just slides in. And it'll click into place once you've got it in there. Okay, so now that we're all set up, we are going to move our tools out of the way, and you're going to pull off this sort of saran wrap covering on the mat. You can just keep it if you want, and then put it back on your mat when you're done. And then we're going to actually open up the bag. When you open it up, hold it upright so any fluid that's in there doesn't drip out and make your mat even messier than it's going to get. Just cut it open. You can throw this away. All of your dissection materials, including the heart, can be thrown away in your regular household trash when you're done. So we're going to take out the heart and we're going to take a look at it. And we're going to look at the exterior features of the heart. Oops, there's some plastic on it. Exterior features of the heart. And you can feel this heart is actually really hard. Mine is particularly hard. Now, a heart isn't normally this hard, but this has been preserved. And we need to look and figure out the orientation of the heart. What's the top? What's the bottom? So this pointy part down here is called the apex of the heart. And it's actually the inferior aspect. It's the part that points down in the body. The top of the heart, the base of the heart, is up here. It's bigger and kind of flat on the top. And you can see there's some holes at the top where the vessels are coming in and out, the great vessels. So in the body, the heart's sitting like this. And it actually doesn't sit straight up and down. It actually sits sort of sideways like that. And when we're talking about the heart again, the left side of the heart is on your right. So this is the left side of the heart. This is the right side of the heart because we're talking about it as if it's from the patient's point of view, in this case, the sheep. And it's hard sometimes to figure out the front from the back of the heart. And so what we need to do is we need to determine where the auricles are. And the auricles are little flaps of skin. Auricle actually means ear, so they look like little ears of skin. And they're attached to the atria. And they're just sort of extra volume in case there's extra blood that's in there. And this is one auricle right here. It's kind of brownish, and this is the other auricle. And so when you're looking at the anterior side of the heart, the auricles should be peeking at you. So you can tell this is not the anterior part because I can see the auricles really well. This is the anterior part. So we know anterior, posterior, we know superior, inferior, and we know left and right. So now we're ready to begin cutting. So we're going to take our scalpel and be very careful. Do not hold the heart in your hand when you're cutting with the scalpel because you can slip, go right through the heart and into your hand. So safety, safety matters. When you kind of feel the heart, you can feel that it's sort of softer on top and a little bit harder on the bottom. And this is because the ventricles are at the bottom of the heart. You can remember ventricle at the bottom because it makes a V, V for ventricle. The atria are at the top of the heart. And the atria have a lot less muscle in them than the ventricles do. The atria do contract, but remember when they contract, the blood just gets pushed down into the ventricles. The ventricles have to have more muscle because they're pushing blood up out of the base of the heart, out of the top of the heart. So once we're ready to start cutting, we're going to find that apex of the heart and we're going to slide our scalpel in. And we're just going to cut along the right side of the heart from the apex to the base. And do you see how my hand is out of the way here? Now you should be able to open this up a little bit and see how well your cut went. I'm a little bit posterior, but I think it'll be okay. So I'm going to cut around the other side, maybe aiming for a little bit of an anterior cut here. And you can feel as you're cutting that it's going to be a lot thicker on this side because the left side, the left ventricle, has a lot more muscle in it than the rest of the heart. You should be able to open this up a bit. And you can see a lot of structures are kind of stuck together here. So this is where we take our scissors and we start cutting from the inside out. And it's going to be tough. It's going to be hard to cut because you're cutting through a lot of layers of muscle. And we're going to cut right through the top of the heart here. Just make sure to keep your fingers out of the way. Don't want to cut anyone's fingers off. Okay, so now we're looking at the inside of the heart. And the first thing I want you to notice is that there's muscle tissue that looks a little bit chewed up because of my scissors. There's more muscle tissue here. And then we have two areas that are kind of smooth and shiny inside. So those are going to be the ventricles, here and here. In between the two ventricles, you have something called the interventricular septum. That's this part right here, interventricular, because it's between the two ventricles. This is the other side. So you've got a ventricle, a ventricle, a ventricle, and a ventricle. When you put them together, that ends up with two ventricles. And the way you can always find the left ventricle is because the interventricular septum is very thick, and the outside wall on the left ventricle is just as thick. Do you see how these two are about the same thickness? Whereas this outside wall is much thinner than the interventricular septum. So the one that has the thick wall is going to be the left ventricle, and the one that has the thinner wall in here is going to be the right ventricle. And you can't really see it very well. You might have to sort of pull it apart to see in there. All right. So other things that I can see here, we might as well start labeling some stuff. These strings right here are the chordae tendineae. They're going to hold the valve down. Here's the valve. We actually got a kind of a nice view of the valve here. Here's the valve. It's very, very thin. And because it's the valve on the left side, we know it's the bicuspid valve. Remember, when we're talking about blood flow through the heart, we start on the right side of the heart. We're going to go through the tricuspid valve on the right side of the heart, bicuspid valve on the left side of the heart. We're going to try it before we buy it. So right here is the bicuspid valve. It's also sometimes called the mitral valve. And in your assignment, you are supposed to label the valve. So I'm going to stick this one through. I'm just using toothpicks because that's what I had. You can also use straight pins or really anything where you can stick a label in. I printed out these labels and just cut them to take less room. So that's the bicuspid valve. And the chordae tendineae are these little stringy things. You can see them also over here. So I'm going to label them over here. I'm just going to stick my toothpick through these strings and put the strings sort of around the toothpick. And I'm going to, oops, I just broke my toothpick. I'm going to stick it in there. And we've already talked about the interventricular septum, so I'm going to put that in also. So we've got a couple of labels. We have our left ventricle, which I'm going to label over here, and I'm going to stick it in there. And we know we have our right ventricle over here. So again, you don't have to label everything on the same side. You can use both sides of the heart to label things. So left ventricle, right ventricle, left ventricle, interventricular septum, chordae tendineae, bicuspid valve. So that means the tricuspid valve has to be over here someplace in the right ventricle. I don't see it on that side, which probably means it's right here. Do you see it? It's easy to find because you follow the chordae tendineae. Okay, so that's the tricuspid valve, and I'll just stick that in there. And when you're taking pictures, I'm not going to be able to see what you stuck it in, but I will be able to see if it's in the right general location. Okay, so since we have the left ventricle and right ventricle labeled on this side, I'll label the atria over here. Now remember, atria, A-T-R-I-A, is the plural for atrium. So one chamber is an atrium. Two chambers are atria. So when we're looking here, which one's the right and the left? Here's the thinner wall. So I know this is the right side. So the right atrium, one of them, is going to be there, which means that the left atrium must be right in here. One last thing, in the actual ventricles themselves, the chordae tendineae are attached to little muscles in the ventricles, and those are called papillary muscles. And so I'm going to label, you can kind of see it right here from the side. I'm going to label our papillary muscle by just sticking a little flag in there. The papillary muscles are going to, just before contraction of the ventricle, they're going to contract, they're going to pull on the chordae tendineae, and that's going to keep that valve, the bicuspid and tricuspid valve, from blowing backwards like an umbrella during ventricular contraction. Now here's the part where most students get really confused, because I've asked you to label the pulmonary trunk and the aorta, and it's really hard to see which is which on this. One of the things that students have the most trouble with is labeling the aorta and the pulmonary trunk. Those are the two big vessels that leave the heart on the superior side. And so what you need to do is you need to think about the flow of blood through the heart. When the blood comes into the right side of the heart and it leaves, it's going to leave the right side of the heart and it's going to go into the pulmonary trunk. It's going to go from the pulmonary trunk into the pulmonary arteries, because remember, arteries carry blood away from the heart. It's carrying deoxygenated blood to the lungs to pick up oxygen. And so we know that the pulmonary trunk has to be attached in some way to the right ventricle. So what we can do is we can take our right ventricle, we can stick our probe in there and see where it comes out. There, it came out that hole right there. So we know that hole is going to lead to the pulmonary trunk because it came from the right ventricle, and there's no place else the blood can go from the right ventricle. So we can label the pulmonary trunk by sticking a little tag in there. Oops, it's not sitting. I can label it like that. Likewise, with the aorta, you can find which vessel it is by starting in the left ventricle and running your probe up and seeing where it comes out. All the blood in the left ventricle needs to come out of the aorta. So here's my aorta tag. And I can go ahead and stick this, stick this in here. I'm having a bit of a trouble with the toothpicks. They're kind of thick. You might want to use straight pins. They might go in a little bit easier. So once you're done, you're going to want to take pictures of both sides of your heart and upload them as one PDF so that I can see all the tags and that you were able to not only dissect your heart, but label it appropriately. Once you're finished, dispose of your heart and the labels in the regular household trash. Rinse off your dissecting tools, dry them, and put them back in the dissecting pouch. And you can rinse off your mat and your dissecting tray and store it until our next dissection. That's it for today. See you in class.